Good morning, and please take your seats so we can get started. Yes, she's around. Good morning, everyone. Please take your seats so we can get started. And welcome to our Capitol Hill Plenary. It's going to be a great day, both here at the Gaylord and in Washington, D.C. Thank you. Well, we've had two wonderful days thus far, Monday and a great Tuesday. And we had a wonderful graduation for 127 coalitions from our academy last night. So thank you all for 2 wonderful days. Thank you. Now it's our 3rd day, middle of the week. Energy level is still up, right? Everybody's ready. Come on, you are the change agents. Yeah, you are the change agents. So Capitol Hill Day is always exciting, and we are so wonderful, and we have a great plan for you today. The roundtable today here is going to be exciting with some wonderful members of Congress, and we look forward to that discussion. You're going to hear from Sue Thaw, the greatest public policy consultant in all of Washington, Sue Thaw, later this morning. That's going to be exciting. We're going to end up with a rally this morning. We're going to have the rally right here at the Gaylord before we board the buses to go to Capitol Hill. Going to have a reception for you on Capitol Hill with some more distinguished members speaking to you there. And then you're going to take Capitol Hill and go over with all of your appointments and tell all of the members, regardless of whether they're in a representative or a senator, the importance of your work and how critical it is that you have their support, and you will get all of the guidance from that. And thank you for being a part of the state meetings last night. I visited several of them, and they all were energized. People were excited, looking forward to the day. We are excited about that. So with such a full lineup, there's no time to waste. I'm going to get started by introducing to you the Honorable Mary Bono. Hey, yeah, go ahead, please, go ahead. I am extremely proud to tell you that she is a member of CADCA's Board of Directors. Isn't that exciting? But a little information about the Congresswoman before we move forward. She was elected to Congress in 1998 to serve the 45th District of the great state of California. She's a devoted mother, an extremely successful businesswoman, a well-known politician, and she was held as possessing the embodiment of a powerful American woman by the Washington Times a few years ago. I know you would agree with that assessment by the Washington Times. Mary is herself a very, very respected, closely watched leader, and she is interested in a wide range of issues. She served 8 years in Congress from 1998 to 2013. She's been out front and leading in many, many issues that are critical to you and to us. One of the ones that she's paid a lot of attention to and continues to do that now, and I'll let her talk to you about that as we're working together on the fight against prescription drug abuse and overdose. She is just an outstanding person, a person who has great passion, great leadership skills. I present to you a wonderful friend, a great American, Mary Bono.
Good morning. How are you all today? Oh, I like that. So, normally when I see you guys every year, I come out and I just say, hi, I'm Mary. And I get back, hi, Mary, and I love that. So, hi, I'm Mary. Thank you. Great way to start. So, I am somewhat scripted here, so usually I am not, but bear with me. Art said he forgot to say one thing. I'm a grandmother, and I'm expecting my second grandchild any day now, so therefore the granny glasses, and it'll script with really big words. But it says, I am so excited to be here with all of you, and I truly am. We've been able to assemble a really robust group of Hill champions who have focused on alcohol, drug prevention, treatment, and recovery to produce meaningful legislation that makes a positive difference in people's lives. And it should come as absolutely no surprise that our biggest champions in Congress have been recruited by all of you during your Hill Day visits. These members recognize that we need to prioritize investment at the community level with those who have the most power to reduce the demand for drugs, and those are your community coalitions. So now I'm very pleased to introduce our first member of Congress who's been here. She's here again this year. She's a great lady, a great friend of mine. This is Congresswoman Lucille Roybal-Allard. She represents the 40th District of California. Come on out and So Lucille is a major champion, and I know this firsthand. She's a major champion for the substance abuse prevention field. She co-sponsored landmark legislation in support of reducing underage drinking, including the Sober Truth and Preventing Underage Drinking Act, which passed in 2006, and the Support 21 Act. She is currently working to introduce legislation to reauthorize the Stop STOP Act. Thank you, Lucille, for being here again this year. Congressman Bill Keating represents the 9th District of Massachusetts. We have the whole country covered. Congressman Keating, I feel like we need bumper music, like imagine AC/DC playing as you see Bill walk out on stage. Congressman Keating has established himself as a passionate advocate for the prevention field. In 2013, Keating introduced the bipartisan Stop STOPP Act to promote abuse deterrent technologies and addictive painkillers. This important legislation helps prevent the devastation of prescription drug abuse and misuse. So, Congressman Keating, thank you for being here. Then Congressman Paul Tonko represents the 20th District of New York. Clearly, the New Yorkers are wide awake. Congressman Tonko has been a strong supporter of substance abuse and mental health parity in Congress. The congressman sponsored Timothy's Law, an important measure in the New York State Assembly that called for parity-based mental health and addiction treatment insurance coverage. Congressman Tonko, thank you for being here. And then last, but in no way least, one of all of our favorites, the Honorable Nick J. Rahal II. Now retired from Congress, the Honorable Nick Rahal represented West Virginia's 3rd Congressional District for a whole 38 years, from 1976 until 2014, a feat unto itself. Congressman Rahal has been active and vocal in raising awareness about prescription drug abuse, championing legislation to promote patient awareness and physician training in safe use and in disposal. Congressman Rahal is winning one of CADCA's Congressional Leadership Awards this year. Please join me in welcoming and thanking Congressman Rahal for being here. So, okay, hi everybody. Hi. So, Nick's retired and I'm retired, but I don't have gray hair. So, never mind. Okay, so we do want to thank you all so much for being here.
I couldn't eat it.
I said, I don't have gray hair.
Oh.
And I'm retired like you. That was my point. Okay, once a joke falls flat the first time, let it go. But I do have a first question for all of you. So how and why did you decide to make community-based drug prevention, underage drinking, and/or prescription drug abuse a major legislative priority in Congress? Lucille?
Okay, I'll start.
in my other life, before I got into politics, I worked for alcohol and drug community projects. And I saw firsthand the devastation of drinking, alcohol abuse, and drug abuse, not only on the individual, but on families and children. And so when I came to Congress, one of the first things I did was to look for an opportunity to find a way to address this issue. And when I got on the Labor HHS Appropriations Subcommittee, I had an opportunity to put in language for the Institute of Medicine to put together to do some research and put together a plan on how to address underage drinking. And thank you. So one of the things that became very evident was the lack of education around parents and the dangers of underage drinking. And so once that report came out, I introduced the STOP Act based on those findings, which began a national information campaign directed at parents. It also brought together all the federal agencies into an interagency council to work together to educate and to find ways to address this issue, because prior to that, the agencies where everybody was doing their own thing. And in addition to that, it also established grants, community grants, so that community-based organizations could also participate and educate parents and families about the dangers. And I believe many of you here have been recipients of those grants. And let me just, since I have the platform right now, let me just add one more thing, because there's a very important piece that's been added to the reintroduction or for the reauthorization of this bill. And that is, it now establishes grants to train pediatric health care providers on how best to screen and test children and teens who have been exposed to alcohol abuse. And that's how I got interested in it.
Thank you for all you do. Does anybody else want to jump in and take a crack? Paul, you want to go down the line? And
Sure. Well, as you introduced me, Mary, and you indicated that I was prime sponsor of Timothy's Law in the state of New York, which offered parity. I think we were the first state in the country to do so. And it was a major struggle to get that legislation done. But part of the struggle was the desire by some political forces to exclude those who are impacted by alcoholism and substance abuse. And as the agent for the bill, I reached out to several groups, and I wanted to know how best to address this legislation. It became very apparent that if you don't get mental health services, if you don't get treatment and response from the medical community for your illness or disorder, many times you will self-medicate. And so it became very important to link the addiction efforts, those of chemical and substance abuse and alcoholism, to the general effort for mental health parity. And it was then that I really understood so well the need to provide services for those who are very brave. I've come to respect those individuals who are into recovery as very strong, courageous people who many times have taught me I take 1 hour by hour to absolutely. You know, I saw your banner saying Agents of Change. Let me congratulate CADCA and let me applaud you all for being the agents of hope. I have seen you provide a new opportunity for people with the work you do. And that's why I wanted to make certain that we included those other elements within the greater work that we were doing. And it was there that, you know, I was introduced to many a struggle. And the reason I got involved with the mental health parity issue was that a young man, Timothy O'Clair, who I met on the Little League baseball field, was a young child struggling with 3 issues: 1 mental health issue, and a mental illness, and 2 mental health disorders. And his struggle was a roller coaster ride. It was absolutely essential to provide the insurance coverage for him and his family. But tragically, Timothy ended his struggle by completing suicide. And I committed to the family to make certain parity was accomplished. You know, he had dreams like every young child would have. And to suffocate those dreams because society didn't respond well enough drove me into the middle of that debate. And then all these other pieces, all the other forces came to alert you, to connect with your senses, to make certain that you understood fully what the struggle was all about, what the need was, how great it was. And the passion that developed there was phenomenal. To this day, I will say the mental health and substance abuse advocacy groups are the most powerful and the most resilient and the most respectful I've met in my days in government. They are just sincere about what they want to change, and I respected those efforts that they shared with us. And that's how I got into this effort, and it has been a mighty walk, one that I look at as one of the greatest accomplishments in my legislative involvement, and one that continues to motivate me, that has built within me a sense of passion because there's an urgency out there. We look at the heroin epidemic today. The work you do is so valuable. It's life-saving. And so we have to get this done, and we have to get it done right.
So well said, beautifully said. I think a little bit of that resonates with everybody, with all of us. Bill?
Well, first of all, Mary, given your introductory remarks and your exchange with Nick, I'm so glad we moved off the topic of hair. And we'll continue to do that, I hope, in this. You know, I've had many windows into to this issue, which is a broad issue. But probably one of the unique windows I had was the 12 years I spent as a district attorney, because in Massachusetts, you had the ability, you know, you had the statutory obligation to go to the scene where there was an unattended death. And you would have to investigate what happened, if there was any foul play. And it really, in the most graphic and concrete way, gave me an insight into what was going on with substance abuse problems, because we saw individuals who were just out of clinics, just working hard for sobriety. They would go back, their tolerance level was low, and so many of them at that stage went in with some of their friends again and died from those overdoses. The magnitude back then, and it's only gotten worse, the magnitude of those deaths just struck me so deeply, because as we look back and finding out what happened, so many of the people never had a criminal violation at all. It became very clear to me that this is a public health issue that just intersects with the criminal justice issue in one sense. And we have to make sure we do away with that stigma, or we're not going to be able to advance and deal with this. And I also saw, again, very specifically, who was affected by this. And it was everyone from every walk of life. We had a case in my county where a state police officer who was involved in an automobile collision, someone slammed in the back, and he had back injuries. He was being treated in the hospital, and he was getting opiate derivative drugs. And he became addicted to them from those treatments. That person ended up robbing banks, a police officer, with armed robberies. I saw a real estate agent who was going from open house to check the medicine cabinets of those houses to see if he could get a supply of drugs that way. I saw successful business people end up in homeless shelters within a year, where they had, one person had an interior decorating business in the swankiest part of Boston. And he turned around, and within a year, because he was in the hospital for surgery and they gave him drugs, became addicted, and he lost everything. So it crosses all those lines, and we know that. Before I was a DA, I was in the state Senate and really was a sponsor of many laws dealing with anti-drug violations and trying to strengthen those laws. And my brother, who was a police officer, said, you know, it's great you're doing these laws, they'll be helpful to a degree. He said, but unless you get at the prevention and the treatment, you're not going to be successful. And all those things pale by comparison. And that's why it's so great that you're here, because we're not going to be successful without community involvement, without you leaving this place once again and going back to your communities as leaders and get the community involved, and the faith community, so many other communities involved. And that's why I'm glad to be here. And that's why I thank you for everything you're doing with CADCA.
Before I go to Nick to weigh in, I just wanted to say to Bill that one of my favorite moments at Capitol Hill was a meeting that you and I had together with a government agency that shall remain nameless. And I think we really gave them a good dose of what we believed they needed to do. I thought you were a very powerful advocate. And that meeting, I think, will forever last in my mind as a great moment in the Congress. So thank you for that.
Thank you.
And Nick.
Thank you, Mary. I know we'll get into this in a later question, but I also want to pick up where Bill left off, and that is to commend each of you for the work you do. CADCA and so many different organizations involved in this effort. You're there on the front lines every day. Thank you. God bless you for what you do. Like so many, my involvement in this issue began on a personal level. Having been in public life for close to 4 decades, all 3 of my children have grown up in the public eye. For my early decades, while it never hit the public arena, but it was a personal nightmare for me to see drug abuse within my own family. And it was that personal involvement, I guess it took, when it hit the public arena, about 20 years ago, when it hit the public arena, then I thought, well, you know, I've got to get involved in this effort in every way that I can. When personal friends of my children committed suicide, it was kind of awakening to them as well because of drug overuse. It was kind of an awakening to them as well that they had to get their lives in order, despite the public glare of everything they did. So that type of hitting home, I guess, caused me to really get involved in this issue. It also made me realize that no longer could I, and I would hope others, if I became publicly involved, sweep this disease under the rug and try to not face it up front and in a public manner. So I started a public discussion rather than having it as a personal nightmare like it had been for my first decades in office. And so many others would come up to me, seeing what I was going through on a personal level, and express their personal stories as well, or if not, say that old familiar phrase, "Oh, but for the grace of God go I." So it was that type of public communication and public exposure that I felt would bring others out as well, and to discuss in a public fashion and in so many different organizations how we can address this issue at so many different levels. It is a complicated, multi-pronged effort that's needed, and I think because of your efforts and so many others over the decades, we have seen progress made in bringing together so many different organizations, including doctors, including pharmacists, including law enforcement, including the judicial branch, including parents at an early age in their youngsters' lives, and teachers, and others, faith-based communities as well, and our clergy. So it's this type of public discussions that I believe we need to continue and we need to address on a multi-pronged effort if we're going to address prescription drug abuse of any nature. And I also want to say a word that I did get involved with my good friend Hal Rogers from Kentucky when we co-chaired the Prescription Drug Abuse Caucus when I was in Congress. He, of course, has taken his position as chairman of the House Appropriations Committee and been able to start the Unite program in Kentucky. I saw the success of that program across the border from me and joined in with Hal in trying to bring that type of effort into West Virginia as well, where we have such a severe prescription drug abuse problem. So that's how I first got involved in this and want to continue my involvement. Thank you, Mary.
Well, your voice will be missed in Congress, and hopefully somebody will come along and fill your shoes, but you've left huge shoes behind that need to be filled. So the next question, I think Lucille really sort of touched on it yet, but Paul and Bill might want to talk about your specific legislative priorities in this Congress that address underage drinking, prescription drug abuse, and community-based drug prevention programs. Right now, what's currently going on? What are you working on?
Sure. Primarily concerned about, as co-chair of the Addiction Caucus in the House, concerned about this heavy issue of heroin in our society. When you hear stats like 80% of the world's heroin being consumed in the U.S., it's an epidemic. It's one that we should assume exists in all neighborhoods and all communities so as to address it in the most robust fashion. I'm encouraged that the President at least has increased some of those commitments in fighting heroin addiction, making certain that our first responders are well informed and educated and trained and given the resources that might include the opportunities for naloxone to be available. Community drug-safe community grant program dollars are increased a bit in the President's budget. I want to see what we can do to maximize that effort. I know that Margaret Brennan would want me to say that, and she's a force in our district that advocates for that sort of policy. And just providing for the soundness of mental health and addiction recovery programs so that we can put an emphasis on treatment and on recovery and certainly on prevention. When you look at the painful outcomes that many are left with the struggle that's there, we want to be able to assist community programs that will reach out and connect with individuals and their families so as to make a difference. And I think our battle is going to be on. We're going to have to hear from the communities that are the service sector out there because there's still this attitude on the Hill that government's too big, government's the enemy, government's the problem. And after having worked in this system from county to state to federal level now for 40 years, my belief is that what this country needs is effective government. Government with a heart that puts a face on all the issues. And I don't see it as an enemy. I see it as a strong partner, so I will fight for priority dollars that go toward the human mission out there to provide safety in our streets and prevention, and then for those who are impacted, treatment and recovery.
Thank you, Paul. And I have some specific instructions for you to go home and do, and that's part of the conference as well. I want you to contact your congressional delegations, your congressmen and women in your districts, and see if they will co-sponsor the STOP Act, S-T-O-P-P Act, which deals with putting protections on prescription drugs that are dangerous. And we've had some success in that regard. We've taken away, the FDA did not approve the generic OxyContins, specifically because they did not have crush-proof and melt-proof protections and technologies that can be put on very simply and protect people from being addicted at an earlier stage, just with experimenting with prescription drugs. That's a no-brainer. We have to deal with it. The FDA later approved Zohydro, a much stronger drug, and didn't include those protections. We have to work on that. That's one thing we can do in Congress. So go back. We need as many co-sponsors as we can. I waited to put the bill in until after this conference, hoping that you'd have the opportunity to do that. There's many areas we can work on, and you're finding from the panel that they're really not bridled by one very narrow corridor. Paul mentioned mental health. That's absolutely a correlation with people self-medicating. We have to do more there. Our veterans that are coming back from the wars, there's such a high incidence of suicide, such a high incidence of prescription drug abuse among those veterans because of brain trauma and other issues where they self-medicate. We owe that to them as we owe it to everyone to work in that regard. And I'm working with the Veterans Administration on some of those difficulties as well. And I think we have to look at the existing programs that are working, programs that are going to give you the tools at the community level to do it. And also, when I was a prosecutor, I put in the first drug court in our whole region as a prosecutor, because I understood that. We need funding for things like drug court. We need to give you the resources back in your communities so that you're armed to educate and prevent people from becoming addicted and abusive. And that'll remain one of the top priorities, because it's the most effective way to deal with this.
Lucille?
Well, of course, my priority is going to be to reauthorize the STOP Act, which is the first comprehensive piece of national legislation to address underage drinking.
The One Piece Stop Act.
The One Piece Stop Act, right. But I want to make a point, because, you know, my bill has to do with underage drinking. We have other bills with prescription drugs, mental health. These aren't separate issues. They are all connected. And so we really need your help and your support, not just to focus on one piece of legislation, but on all the issues that we have been talking about, because they're all connected. They all negatively impact the family. In many cases, when I was working with heroin, primarily heroin addicts, you know, a lot of them, it started with drinking, and then it gradually progressed, you know, to more and more use. And in my own extended family, I have seen the devastation of heroin addiction and how it creates this cycle. It doesn't end just with that person. Not only is it devastating to the family, but in my own example from my own extended family, there are now the addict has children, and now those children are having a terrible life. One young girl who's 13 is cutting herself. Another child who is 7 years old, the daughter of the same father, two separate addicted mothers, is constantly having tantrums. And so this is a cycle that we have to stop. And it isn't, as I said, just focusing on alcohol abuse. It's focusing on all these issues. And we really need your help and your advocacy, because each and every one of you are on the front lines every single day dealing with these issues. You know better than anyone the devastation that this causes. And we need your help and your support to come and talk to our colleagues, tell your personal stories, tell about your experiences, because that's the most powerful way to advocate and to help us to be successful in passing the legislation that we're talking about here today.
That's the perfect segue into next question, and I think it's a great question to start with Nick. With 38 years of experience, how much power do regular constituents, like the CADCA members who are here today, how much do they really have on a member's decision?
Huge. Huge. Just tremendous amount. I believe that organizations such as CADCA, your visits to the Hill this afternoon, your work back in the communities, your visits with your member of Congress or senator or any public official when they are back in the district, through letters, through personal visits, through staff contacts, all your multi-pronged efforts have a tremendous impact upon a member of Congress. Certainly each one of these members will attest that their first and foremost interest is the people that sent them to Congress in the first place. And that interest comes above and beyond all other interests in Washington. And because of the attention, the public attention that this disease is getting across the country, and because of the unique circumstances in certain districts that make it more of a high-profile issue, your work and your lobbying, if you want to call it, upon your member of Congress it does have a tremendous effect. It's not political. Certainly every member realizes that this issue crosses party lines, it crosses philosophical lines, it crosses geographical lines, it crosses all societal lines. It doesn't matter whether you're 9 or 90, you're affected. Every person in this country is affected by this issue. Doesn't matter whether you're seeking a job or whether you're an employer. So many employers today cannot find individuals to work for them because they cannot pass the drug test. That's an issue that affects our economy. The economic drain upon our economy as a whole is tremendous because of substance abuse or drug abuse or alcohol abuse. So your work and your bringing these facts and points out to your member of Congress, it just has a tremendous impact, in my opinion, upon legislators in this city.
Anybody? Bill?
I'll tell you, when it comes to discussing these issues with members of Congress, we've obviously had conversations with our colleagues on this issue, and I think all of us realize that most members of Congress, the vast majority, have had family members or loved ones, friends that have just been touched by this terrible, terrible scourge. And when you get involved in a personal conversation, that they open up to you and tell you that. So you're halfway home when you're trying to communicate with members of Congress because they know this, they feel it, it's touched their lives. But what your involvement really is indispensable for is getting us all the way home, because we're just thrust with all kinds of political issues, and you probably sat with the same frustration I did this weekend. They're having, and I don't mean to demean the seriousness of this, but they're having hearings in Congress this week on measles and on the outbreak of measles and vaccinations, and that's important. In our last campaigns, I think you heard so much about Ebola, and that's important, and we dealt with it. But there are 46 people dying every day in this country because of drug overdoses every day, and we're not raising that to the level that we're dealing with it. And we need you to do that. And when you communicate to your congressional leaders, they understand it. You just have to raise that issue up with those of us in this panel to get the rest of the job done.
Mary, I would suggest to all of us that in our founding moments as a nation, there was great struggle and intrepidation to make certain that we put together a system that allows for we, the people, to be heard. So traditionally, we've taken that value as a very sincere one in our society, in our government, and we need to hear from people. That's what makes the system work. We're at an interesting juncture in time where there's undue influence from deep pockets of those of the highest strata of wealth and of corporations. You need to drown out the dollars with your voices. You need to be heard, now more than ever. We need to make certain that we are a government of the many, not government of the money. And there are those who are out there, that, again, talk about the bloat of government, the big quality of government, the evil that government brings, when in fact, look at the facts. You can throw myth our way, or we can deal with it in factual terms, not fiction terms. We have reduced by billions the commitment to mental health in this country over the last years. We need to be heard. The community of advocacy needs to be heard. CADCA needs to be heard. And you know what makes this work the best is anecdotal evidence. When we were getting parity passed in New York, I made certain people heard, my colleagues heard, the stories, the painful stories of anguish that individuals and families endured because there wasn't a government response where they needed it. And so bring those cases of evidence, bring those true life stories. They can help but inspire us as legislators. And if you still have a hard heart to it, then perhaps you'll be overwhelmed with some stories that finally get to you. You know, when the Eau Clairs brought the story of Timothy to us, they came to me, we went through a scrapbook that started with his being brought home as a toddler from the hospital, and the scrapbook ended with a Christmas tree at his gravesite. I said to my colleagues, open your door, because the Eau Clairs want to open their heart. Theirs is the much tougher mission. That's what it takes. That's government with a heart. And I'm not afraid to say that we need to deal with a heart in government. So let us hear those stories. They're very impacting, they're very powerful, and they will drown out the undue influence of far too few in our society that are reducing our commitment to these programs.
Lucille, you want to weigh in, or?
Well, let me just, I guess, summarize what my colleagues have said. And responding to a question that I'm asked all the time is, does it make a difference when we come and talk to members of Congress? Does it make a difference when we come across the country and come to Washington, D.C. to talk to our colleagues? And I think what you've heard is absolutely. You make a critical difference, and you are essential to helping us to be able to pass legislation, to educate our colleagues about the devastation of drug abuse in this country. And I just want to say thank you to all of you for everything that you've done, because we could not be successful if it were not for folks like you.
So, Lucille, I just want to ask you a specific question, and anybody, of course, can weigh in, but as an appropriator, how is it that, you have a lot on your plate. You have to weigh basically the money. And at the end of the day, money matters in these efforts, and we need to fund these efforts and get the grant funding out there for the people who need it and fund great efforts like CADCA. So how do you get into an appropriator? What works with specific language on the people like you who actually decide where the money goes?
Well, unfortunately, right now, one of the biggest struggles is, of course, that there are those who are in Congress right now, and unfortunately many in the country, who are buying into this idea that smaller government is better, and as a result, we are cutting programs rather than investing in the programs that are so important to our country. And when it comes to appropriations, Labor H, for example, which deals with the funding for the critical programs in healthcare and education, all these things that are so important to the majority of our country, that is the one bill that we can't even get marked up. We can't even get it into marked up and voted on, because of the fact that the money has been cut so much that there's almost nothing left comparatively to really address the issues that are important. So I guess what I'm saying is, don't buy into that rhetoric. As Paul said earlier, government and its involvement, yes, it has to be transparent. Yes, it has to be held accountable. But don't buy into this rhetoric that by cutting and less government, that's the best way to go, because we need the federal government to help to support the very programs that will help you to do the work that you do with regards to addressing the serious issue of drug abuse in this country.
Sure. Anybody, if you want to weigh in, please do.
Yeah. Mary, I would say that a budget reflects who we want to be, who we are and who we want to grow to be. I would suggest that a message of compassion is so critical these days. If anything bothers me right now in this job is when so many human services groups come in, groups like yours, with hat in hand saying, I know there's no money, but, and then they'll give me the worthiness and the justification of their appeal for their program dollars. Don't be bullied by these messages that we can't be compassionate. We live in the richest nation in the world. It's time to have a good, meaningful discussion at the tax reform table. There are dollars that need to be rendered for programs like this, with everybody paying their just share. And we haven't had that of late. So we set high priority on this. Look, prevention is a tough commodity to sell. It always has been. But the message here, pay now or pay dearly later, not only in dollars, but more importantly, in human lives. So that message has to resonate. We need to be somewhat rebellious. We all have served with John Lewis, the last living member of the March on Washington for Civil Rights in 1963. I love John. It's like serving with an icon of history. The pages of history come alive when you're with John. We have a Brother Paul, Brother John working relationship. He has said to me, Brother Paul, make trouble, good trouble. Good trouble. So let's make good trouble on behalf of the people we all want to serve.
And if the compassionate side doesn't work, let's put on our green visors or something and start number crunching. Because one thing we have to do as a Congress and as state legislators, we have to get good data first. I was really shocked when I was a district attorney. I looked back when I began to see the incidents of what was going on and tried to get some statistics and data around what was going on. And it was 6 years old, and it was of no relevance. One thing we have to do is start to get more information so that we can take the second step and say, you know what, everyone in this room knows this. This is costing us more in dollars. Forget the lives even, which is the number one issue. This is costing us more in dollars that we're not acting on it. They've given very conservative estimates, $6 billion a year on worker productivity and criminal justice system. And what's the cost of one liver transplant or dealing with the high cost of hepatitis C and those issues? It's astronomical in our health care cost. We had a situation where we were putting a program together in Massachusetts, and the news media came to us and they said, well, that's all well and good. You know, how can you afford to pay it? And I said, if you really knew the dollars and cents and everything, how could we afford not to pay it? It costs less to deal with this on the front end and where you're working and in prevention by far than on the back end. And that doesn't even touch the human costs.
Sure.
Okay, I just want to add to that, because one of the problems that we face, both as appropriators and in terms of the budget, is that we all know that prevention saves money. The problem is that the Congressional Budget Office, CBO, they can't score that, or at least they say they can't score that. So since they can't score it, then it can't be added into a consideration when we're doing the budget. So there are some of us who have been working over the years to find ways to make prevention scoreable so that it will positively impact the budget and the money that is available. So I just wanted to, I don't want to get too much into the weeds, but I just wanted to throw that. That's the problem. We know it saves money, prevention does, but we can't score it, and so that's why it impacts of the allocations and the budget.
Right. I think every member of Congress gets frustrated by that in one way or another. Nick, you wanted to?
Well, I just wanted to add quickly, each of you have tentacles and networks within your communities and states that go beyond just your particular organization or your particular lobbying efforts, if you will. I'm talking about your business partners, your private sector partners. Bring them, if you can't bring them to Washington with you on visits like this, when your member of Congress goes back home, bring your partners in this effort to meet with the representatives that represent you as well, so that he or she can see that this is not just a narrow group coming to see me on their concerns, but this has a much broader impact and support within my constituency than just the people that I'm looking at, that it goes into the business community, your support. You have financial help show your member of Congress that the private sector is stepping up to the plate and doing their fair share, we hope, in most cases, to help you. And therefore, there is a role for the federal government in this effort as well to partner with the private sector.
I'm going to go off script a little bit and ask a question and make a point, and I think you guys will help me with it. And I'm going to start with an anecdote or a story, and that's how important the staff is in a congressional office. And I remember when my late husband, Sonny Bono, was in office, some constituents had come in and were really screaming and yelling at the staff and screaming and yelling at Sonny, which generally speaking is not the most effective way to advocate a position. But afterwards, these constituents asked Sonny if they could take their picture with him, and the staffer stood up and was glad, so happy to take your picture with the congressman, hand me your cameras. And so Sonny and all the constituents stood up. I watched the staffer take the photograph, and the constituents walked away. I said, that was really gracious of you to be so nice to offer to take a photograph with a congressman. And the staffer said, it's okay, I cropped out all their heads. And it's sort of anecdotal for when you leave the office, what you leave behind matters. And I only bring this up because I know how busy all of you are going to be while CADCA is in town. And they're all expecting to come to the Hill and see their member, and I'm sure every member is planning to see their constituents. But oftentimes you guys are going to be called away to votes and to the floor. How should these great people, passionate advocates, come to the office, and then when you're busy, can you explain how important the staff is and how they might approach the staff, and still that they're an important part, if you're not there, that your office still cares, and talk a little bit about the interface that they might have with the staff in your office?
Well, absolutely. I mean, staff is absolutely critical. As Mary said, we wish we could meet with everyone that comes to our office, to every constituent. But it's either votes or hearings or other things that are happening that make it impossible for us to meet with everyone that comes to our office. So we depend a great deal on our legislative staff. And it's important that you know that when you do meet with staff, they report back to us who they've been meeting with, what the issues are, what constituents have come into the office. So please don't feel that because you've met with staff, somehow that visit will not get to the member and that your message will get lost. It definitely does not get lost.
I think that staff plays such a key role. But let me just define what my coworkers and I are about. I think that we all need to reflect as a team the values that are common to that office. I ran for government posts along my career to fight for the underdog. I believe our government, and I believe totally in quality government. Quality government is that which pours forth respect and dignity and compassion to those it hopes to serve. And so I remind all of us, all the time in the office, we are public servants. We are there to serve you. And so I just ask you, when you come in and meet with staff, understand it's an extension of members. Usually members are reflected by the people that they're surrounding themselves with, because it just works that way. If you're not fitting into that model, you probably do leave. But in most cases, staff will reflect the general member. And I want that to be the case. In closing, I would also like to ask you, you serve so many people, each of you, and I'm looking at this force, which is immeasurable here. I mean, talk about a force to be reckoned with. I would ask that you just reflect today on the great numbers that you serve. Hear their pleas for help. Hear those pleas, see those faces in your mind, and then have that motivate you. Have it lift your voice. Have it fill your voice. Speak for them. Get loud, make good trouble, and come to us and our coworkers and make it happen. I just beg you, we need to work as a partner here to turn this system around.
Well, staff is also important member to member. Yesterday, a member grabbed me, and he's a doctor, and he grabbed me and he said, I heard about your bill from my staff. Someone called my office about the Stop Act, and we started talking. And as a physician, I said, and this is good because our time is getting closer, so I'm going to segue into another important area, I think, and that's the medical community and their role. Because without them, we're not going to change things. My own daughter fractured her wrist recently, and she just went to an urgent care area to make sure what was going on. They took an x-ray, and all of a sudden the doctor came in with a prescription for an opiate drug. And she works in the courts, and she looked at that and said, why are you giving me this? I was going to take a couple of Advil. And he said, well, this is for the pain. And she said, do you know how many lives you're ruining? Do you know what I see in my...
Good for her.
She did. And
Good for her.
the doctor did a 180 and left the room. He wasn't very happy with that. But we have to deal with this issue, and it's a difficult issue. I'll just make sure I get this point, because Mary brought it up about a meeting we had. And it was with the FDA, and it was with the physicians and all the experts from the FDA. And we were there talking about this issue. And I must admit, my Irish got a little up, I think.
It did. It was awesome.
Because they started to preach to us. They said, Congressman, you don't understand about pain. You don't understand how important this is for pain. And you know, we should basically educate you on this. And I just was furious, and I said, let me tell you about another kind of pain. Let me tell you about the pain I've seen in my family. Let me tell you about the pain I've seen as a district attorney with families. The pain of families being torn apart, the financial ruin of people, the pain of losing a son or a daughter. That pain doesn't go away the way the kind of pain you're talking about does, and we have to do something with that. And there's progress being made with the medical community right now, and some of the models that are there we should all take back to our areas, because that is an issue we have to deal with.
Now you know why I remember the meeting so well. But it really was a great meeting, because you saw that passion, but there were about 8 of us, or 6 or 8 of us around the table, and we each had passion. So thank you for that, and for sharing it so lively and well. Nick, do you have a thought on anything at all at this point in time?
Well, you know, again, as we're concluding this session, to thank each of you for your work. And as been referenced so many times during our comments this morning, this is a multi-pronged effort that's necessary. There is no one person, no one individual, no one organization, no one piece of legislation, no one single level of government that's going to solve this issue alone and by themselves. It takes all working together. Everyone's effort is important and can go a great deal toward making the progress. We recognize this is a long-term war, if you will, in which we are involved. As we make progress in one front, we see another problem develop, like we are today with heroin abuse increasing. But we also recognize that, as Bill has referenced, the medical community is stepping up to the plate for the most part. The pharmaceutical community, maybe a little less so, but still there are those in the pharmaceutical community stepping up to the plate, either contributing or making reforms within their organizations. There are those in the insurance industry, and let's not forget their role in these prescriptions that Bill referenced are being prescribed for people unnecessarily as well. So the insurance industry has a role. Everybody needs to come together and address this in their own manner to make the progress that I really believe we are making.
Lucille?
Well, and let me just say, if there's just one message that you come away from today's discussion, I hope it's that you understand just how powerful you are and how much you have within you to make the changes that are necessary to address this critical issue of drug abuse in our country. And as was said earlier, this isn't a Republican or a Democrat issue, this is everyone's issue. And I just want to make note that my original co-sponsor on the reauthorization of the STOP Act is Mike Fitzgerald. He's my Republican co-sponsor, and unfortunately, due to an operation, was not able to be here. But he's a wonderful partner and who is helping to get all the co-sponsors that we want, and I hope you're going to be out there on the Hill getting more co-sponsors for the STOP Act, which we hope to introduce very, very soon. But Mike Fitzgerald is very key to that, and I hope that you recognize that and maybe stop by his office to say thank you.
So with that, we're down to the lightning round of last final words or comments. Anybody want to say before we get the...
I just want to thank you for the wonderful invitation. Mary, I've enjoyed this, as has Jeff Morgan, my worker who deals with these issues. So when it comes to the staff item, we're always involved and invested. I appreciate it. I just want to thank everyone for being those agents of hope. You have rendered this mission indeed possible. So thank you so much.
Bill, anybody? No?
I again want to thank all of you, and again, Mary, I want to thank you for your leadership that you had as a member of Congress and carrying that on afterwards. It's really a great story.
Well, thank you. It's passion, and I guess on behalf of the CADCA audience, the CADCA staff, who, by the way, we should all applaud because they work so hard and tirelessly, and I'm proud to be a part of their family. I think all of us in CADCA want to thank all of you because you're true champions, and I know many of you have been here year after year, and we thank you very much. We thank you for your leadership on the Hill. We know we're kindred spirits here. You're not hard to convince, but you have a lot of heavy lifting to do with your colleagues. So we want to thank you for being a part of our day here at CADCA, and God bless all of you and your tenure, and have a great day with all of them today on the Hill. So thank you for being here, and at this point, we're going to ask Nick Rahal to stay on stage because we are going to present Nick with a big award, a well-deserved award. So the rest of you are ready to head. We know you have to head back to the Hill quickly, and thank you again for being here.
Before you run, let's give them a great round of applause. Also, I want to get a picture, please. Sue?
Okay.
Good to see you, by the way.
Now you know that we have some very passionate, powerful leaders in Congress. We should thank them for taking the time to come over and spend with us this morning. And I would ask you to please give them, as they're leaving, one more round of applause. Please do that, please. Thank you. And our, if I might use this term, our in-house champion, please help me thank the very special Mary Bono. Thank you very much. Thank you. Now I would like to have you help me recognize a distinguished member who gave 38 passionate years serving the great state of West Virginia in Congress. Congressman Nick Rahal. As you heard earlier, he's now retired from Congress, but his friends in West Virginia are here in number, and they are very, very appreciative of his great work as well. He's been active and vocal in raising awareness about prescription drug abuse. You heard him talk passionately about that. He's been a champion for legislation to promote patient awareness and physician training and the safe disposal and use of medicines. At the federal level, the congressman worked across partisan lines, which is so critical these days, to forge relationships and partnerships to work on prescription drug abuse, and was, as you heard him say, a member of that caucus. He worked back in his home state to increase the number of counties within his district with the Appalachian Highest Intensity Drug Trafficking Agency, HIDTA, as we call it here in Washington. He secured additional support and resources to support not only his district, but throughout the state. So for a very passionate, very courageous, and outstanding leader, one that we have benefited from years and years, it is my honor on behalf of all of you, the CADCA's Board of Directors, to present to the Congressman this great Congressional Leadership Award and to thank him for all of his wonderful support. Help me in recognizing the congressman. So the Honorable Nick Rahoff, the second, right? In recognition of your sustained commitment as a champion for drug demand reduction and community-based prevention, it's our pleasure to give you the 2015 CADCA's National Leadership, at our CADCA National Leadership Forum, this Congressional Leadership Award as a token to say, thank you, God bless you.
Thank you. Thank you, John.
Let's get a
Thank
picture.
you.
Come on, man.
Thank you.
Get a picture. Where's the next picture? Please.
Wow. You know, when I think about everybody in this room, and especially my dear friends from West Virginia that are here in a large number, you know, this award, really, I appreciate it very deeply, but it is something that will always remind me of the tremendous work that each of you in this room and so many others are doing across this country. Not for yourself, but for the benefit of generations to come. Because as I said in the beginning, you are on the front line. You are there every day, helping people from the early walks of life to the latter years, to educate them, to be there as a sounding board, to be there to meet their failures and address those failures, and to be with them when they succeed and have recovered and move on to a brighter life. So I really do appreciate and I humbly accept this award, but I know that it's each of you in this room that are so much more deserving of recognition. And I thank you, and God bless each of you. Thank you. Oh, okay.
Thank you so much.
All right.
God
Thank
bless.
you. Thank you. Appreciate it.
Well, what a great panel we had. Great discussion. And they gave us some wonderful advice, too. I know you're going to heed that advice that they gave us as a way to work with them, their staff, and to demand of them that they, in fact, do for us what is rightfully deserved in all of the communities that you represent. Now it's my pleasure to introduce to you no stranger at all, who's been serving us as our CADCA Congressional, boy, I'm really getting all messed up here, but Sue Thom has been our public policy consultant since January of 1993. January of 1993. So you add up the years, huh? She's been representing us. As I said earlier, she is the best public policy consultant in all of Washington. And her actions speak that, and her actions tells us that. You know, we only started a few years ago tracking the dollars that we've been able to save as an organization for you or add to legislation that would not have been there for you. And we now have totaled up the amount of dollars that Sue and her team have been able to restore for you and provide for you that would not have been there, $2.79 billion. Think about that. $2.79 billion. So we as a field are extremely lucky to have had Sue all these years. Think about it. Most organizations in Washington would just give anything to have the consistency, the dedication, the professionalism that goes from 1993 to 2015 and continuing strong. That's why we've been successful. It's the consistent leadership that we've had in this field, and we appreciate it very much. So I want you to give her your attention. She has some advice and guidance to give to us. This is a challenging time that we find ourselves in. Not easy. We've had some difficulties. We need to know exactly what we can and cannot do as it relates to federal dollars. And it doesn't matter that we have the passion or the desire, but we have also restraints. And we got to control our passion and let that passion be implemented in accordance with the requirements that come from the federal government for the betterment of our total field, so that we can continue to enjoy the great support that you've heard this morning and that you will receive this afternoon. We know we can pull the two together. Sue's going to direct us in making that happen. So that's why I want you to give her your full attention as she comes to talk to us. And we also want to thank her for her passionate support and leadership. I present to you Sue Thaw.
Good morning, CADCA. All right. Are you pumped up or what? Okay. So today's Capitol Hill Day really is a day of celebration, reflection, and rededication. We celebrate our mission possible. We are here 25 years later, stronger, smarter, and more committed than ever. Who would have thought 25 years ago that we would be here today, not only having survived, but having achieved major population-level outcomes that seemed impossible at Forum 1 25 years ago? Who would have thought 25 years ago that we would see underage drinking and teen cigarette use at their lowest levels in the history of the Monitoring the Future study? Or, and this is an amazing outcome, 2014 would mark the highest number of young people totally abstaining from using any substances in their lifetime in the history of the Monitoring the Future study. These are incredible outcomes, and we need not only to celebrate these fantastic accomplishments, we need to take credit for having helped achieve them. We need to get over being shy about pointing out the fact that prevention works, and we know it, and we have the data to prove it. We in the substance abuse prevention field have had a major part in achieving these outcomes. And today on Capitol Hill, we need to point out and take credit for our collective work, because what you do every day in your communities to reduce access and availability to youth of both alcohol and cigarettes has worked. We've changed social norms. We've increased perceptions of risk about smoking and underage drinking. We've spent the past 25 years doing what works, and guess what? It actually has worked. Yep, we need to celebrate that. Today is also our day to celebrate that we continue to be heard loud and clear on Capitol Hill. Do we have some amazing champions? Unbelievable. We have seen our support grow over these 25 years from a few major champions, many of whom have spoken to us this morning, and you'll see at our congressional reception, Senator Grassley, Senator Portman, Senator Ayotte, Senator Whitehouse. We have unbelievable champions, but we've grown that champion base from a few people to, get this, about 100 members of the House of Representatives and about 30 senators sign on every single year now to ask the appropriators to fund the Drug-Free Communities program at the highest possible level. And make no mistake about it, it's in large part because you go to Capitol Hill every year on CADCA's Capitol Hill Day. And as Aristotle said, we are what we repeatedly do. Excellence, then, is not an act, but a habit. And we all need to be in the habit of continually building lasting, long-term relationships with members of Congress and their key staffers. And we need to use today to build on these critically important relationships. One of the reasons that we've had such great results from our meetings on Capitol Hill every year is that these are in-person meetings. And in the hierarchy of what counts in helping members care about and shape policy, in-person meetings carry the most weight. Actually showing up means nobody can ignore you. Are you here in force today? Yeah. Showing up every year is a large part of why CADCA has the power to get things done for you in D.C. Just think about what we've accomplished over the past 25 years working together. We got the Drug-Free Communities Act authorized and funded. The program has grown from a $10 million program in 1998 to a $93.5 million program this fiscal year. We worked with Lucille Roybal Allard and Representative Wolf and Representative Fitzpatrick from Pennsylvania to get the STOP Act passed. Sober Truth on Preventing Underage Drinking, the One-Piece STOP Act. And to see that it included a community coalition enhancement grant program for current and former drug-free communities grantees to enhance their communities' underage drinking efforts. And you know what? We didn't just get this on the books. We've gotten $5 million a year appropriated for those enhancement grants every year for the past 8 years. And you helped do that. We've used our collective power to save funding for our entire field. We've worked to ensure that the 20% prevention set aside in the Substance Abuse Prevention and Treatment Block Grant not only has been maintained, but it still has to be used for bona fide substance abuse prevention activities. It's a major accomplishment. Thank you. And General Dean just said this, but since 1994, working with you, we have saved $2.79 billion in funding that would have been cut or never appropriated for the alcohol, tobacco, and drug prevention field. It's amazing. Now, I just told you the Drug-Free Communities program was funded at a level of $93.5 million for this current fiscal year. But I didn't tell you that we had to fight very hard to get that funding level for that program. Last year, the President's budget proposed to cut the program by $6.3 million. And it was through our collective work, sharing both the great outcomes from the national evaluation of that program that are in a two-sided one-pager on the Drug-Free Communities program in your Hill packets this year. Okay, really important to share that on the Hill. We also were able to collect your local outcomes from this program to share with your members of Congress so that they could see this didn't just work in a national evaluation, this works in their states and communities. We are reducing population level rates of 30-day alcohol, tobacco, and marijuana use in communities throughout the country. Our program works. And that's what convinced the appropriators, get this, not only to restore the proposed cut, but they added another $1.5 million to the program over the previous year's funding. And that's how we got to the $93.5 million. So these appropriations wins over many years are really impressive. They are major accomplishments, and they took our collective power to achieve. We need to use today as well as a day of reflection to look at how far we've come over the past 25 years, from a nascent group of a few hundred coalitions into a true movement. Believe me, folks, we have recognition and we have power, and that's because we are a movement. Yep. You are recognized as experts on Capitol Hill in community-based alcohol, tobacco, and drug prevention. And make no mistake about it, explicit alcohol, tobacco, and drug prevention would be gone without our collective efforts to save the funding for our field. We have used Capitol Hill Days past to ensure that members of Congress were educated and understood that not only is ATOD use totally preventable, but we know how to do it effectively. We rock. The only way your members will understand that many of the other major social and economic issues they care about, whether it be education, jobs, the economy, or health care, not one of these can be effectively dealt with or properly addressed without a major focus on reducing alcohol, tobacco, and drug misuse, abuse, and addiction. Yeah. And you need to use today to be clear in connecting these dots so that your members understand that investments in our field are needed to reduce healthcare costs, raise academic achievement and graduation rates, and to help people get and keep jobs. We matter. We matter in the big P policy world. So, today is our day to get back to basics. As Jim Rohn said, success is neither magical nor mysterious. Success is the consequence of consistently applying the basic fundamentals. And for today's Capitol Hill Day, the basic fundamentals are really simple. All you need to do is make sure your members know who you are, what you do, who you work with in your community, what your outcomes and accomplishments are. We're not asking you really to do anything but educate your members about your work, its critical importance, and the challenges that you still face. And what federal programs are critical for you to be able to continue to do your great work at the state and local level. The biggest ask we have is to just get on the buses at the end of this session and go up to Capitol Hill and educate your members to put a face on what really effective, great ATOD prevention, intervention, treatment, recovery looks like. Now, to make your Capitol Hill Days as effective as possible, before you ever got here, when you signed up for the forum, we provided you with templates, and we encouraged all of you to use them to create your own one-pagers for your Capitol Hill Day visits. These templates showcase the names of all of the members of your coalition in all 12 sectors. So the name of your police chief, your school person, who you work with in the community. So when they look at that, they know you're representing the community. Okay, and the only other thing we asked you to do and bring is to bring a one-pager that displayed your successes and your outcomes visually in chart or graph form. How many of you prepared those one-pagers and brought them along? Okay, fantastic. If you didn't, that's the most important information to share. We have reduced ATOD use in communities. Use those one-pagers if you've brought them. They're going to be a really powerful tool because they're going to be critical in showing very quickly in a short meeting with members and/or staff that what we do works and has outcomes and is cost-effective. Today is the day to get substance abuse prevention on the national agenda. You do need to build relationships with your members, but not to lobby anybody. We're not asking you to lobby. We're asking you to become a resource so that your members and their staff rely on you for information about our issues, what you're dealing with, and they're going to listen to you. Because you heard today, elected officials are generalists. They deal with a slew of different issues every day. They're not experts on ATOD prevention. We are. We're the experts. And you heard today, legislators respond to the issues that are brought to their attention by their constituents. What you have to say matters. You vote for them. You're the people that put them in office. They will listen to you. Now, there are a lot of new members in town, a lot of newly elected people that we maybe don't know yet. They need to know you. They need to know about your work. Whether you have set up appointments or not, get on those buses and go to the Hill, and at a minimum, see who in the office will meet with you. How many of you have meetings set up? I have, okay, fantastic. Anyone who doesn't go to the Hill anyway, meet your congressional delegation, because there's no better opportunity to educate them than today when we're all here in person. Look at the chart in your Capitol Hill Day folders called the CADCA Watch List. It lists the main programs that fund our field and that we have fought for and continue to fight for. Now look at that watch list and be sure to let your members and their staff know which of the programs fund your work. Just point to them or mention them. Please make sure that the core set of specific federally funded alcohol, tobacco, and drug prevention, like the Drug-Free Communities Program, STOP Act Program, SPF-SIG Partnership for Success Program, 20% set aside in the block grant, folks, those are the only programs left that still fund our field. We all need to get the message out loud and clear that what we do is unique and that the programs that fund our field must be funded at the highest possible levels. Now, I have one piece of bad news to share with you, and it's something that we're going to have to work on. The president's budget that was released on Monday proposes to cut the Drug-Free Communities Program by $7.8 million from the $93.5 million that we worked so hard to get last year to only $85.7 million. We need to convince Congress, not on lobbying, but by sharing who you are, what you do, and your outcomes, and that we matter, that that cut cannot stand. We must get that money restored. And I promise that we will do everything in our power to make that happen, but you have to put a face on the program for us. So I only have a few minutes left, but I want to say yes. Do we still have major challenges with prescription drug abuse, marijuana use, synthetic drug use, e-cigarettes? You bet we do. But we're also dealing with a lot of misinformation, especially about the science of addiction. To rephrase the famous quote from the New York Sun from 1897, yes, Virginia, marijuana really is addictive. And 1 out of 6 kids who start using it, 17%, will become addicted. Early persistent use can cause an 8-drop point in IQ. And we have a one-pager in your packets that NIDA gave us that puts in one page all of the negative educational outcomes for adolescents associated with marijuana. It's the science. Please share it and get it to decision makers. Now, there's one other really important thing. with all of the talk about prescription, drug, and heroin crises, and boy, is it a crisis, right? More people dying of overdoses than car accidents and gunshot wounds. This is a crisis. But most people are focusing on downstream solutions that we totally support. Do we totally support medication-assisted treatment? Yes. Do we totally support naloxone, the overdose reversal drug? Yes, saves lives. Critically important. Is any of that substance abuse prevention? No. We need to make sure that people on the Hill understand the front end of this problem is the most critical component to solving it. If people and kids don't start using, they're not going to end up in trouble. We need to fund the entire continuum of care. We need to fund it all. And we cannot leave out the front end. There's a bill that was introduced last session, going to be introduced again this session, called the Comprehensive Addiction and Recovery Act, affectionately known as CARA, okay? CARA. We have a one-pager about this in your Hill packets. That bill includes, now get this, a new enhancement grant program for current and former drug-free communities, grantees, built on the STOP Act model to give you guys who apply up to $75,000 a year for 4 years to do about prescription drug abuse what you've done about underage drinking. We can make a difference. We have got to be in the mix. We support the whole continuum, absolutely, but we can't leave out the front end. I want you to please also thank any of your members. We at the state meetings gave out a one-pager who have supported us on DFC in the past, signed on to the STOP Act, Sober Truth in Preventing Underage Drinking, the one-piece STOP Act in the past, or signed on to the Comprehensive Addiction and Recovery Act, CARA. Now I want to tell you, getting us on the radar screen of Congress wasn't easy. But if we don't do it today, nobody's going to be doing it. It's up to us. It's always been up to us, and we have always risen to the challenge. Always. If you have youth in your meetings today, they are the most important spokespeople we have. They put a face on the issue. Let them talk about marijuana. Let the kids talk about what's going on with their peers and their perceptions of risk and use about marijuana. And I want to end this part of this session by using a quote from Carl Bond. Though no one can go back and make a brand new start, anyone can start from now and make a brand new ending. And today is our mission possible to go up to Capitol Hill to ensure the best possible brand new ending for our field becomes a reality. Thank you. Okay, thank you. Thank you. Thank you very much. Thank you. Okay, well now we have a really big treat for you. If I can ask the people who are going to be participating in our rally to please come up on the stage. And while they're doing this, we have an unbelievably great CADCA flashback to show you from Representative Elijah Cummings, one of the most passionate speakers on Capitol Hill. Please roll the video.
Speak your mind, pour out your heart, love your soul. Speak your mind. Speak your mind when you go to the coalition meetings. There's so many people that go to meetings, and because they feel that they have nothing to offer, they say nothing. The reason why we have coalitions is so we can bring thoughts together. And when you fail to speak up, you deny the coalition your expertise.
Good morning. My name is Anant Ghosh. I am from the Series C Coalition of Chelsea, Michigan. I have been an agent of change. To this day, I have inspired my friends and my family to join prevention coalitions around the country. Though it may not seem like much, these are small steps to lead to a better community and a safer one. I am also a part of a coalition that is starting an advocacy for policy change. I make it a point to inspire everyone I meet so that they take what I tell them to heart so they can take it back to their community to become the next agents of change.
Good morning. I am Jennifer Bass from the Community Prevention Coalition in Pima County, Arizona. I am going to use today to be an agent of change by being a positive presence in my community and for fellow peers and advocating for my community and peers. As someone who truly cares about the betterment of my community and the lives of others around me, the chance to speak to the people who have the legal power to make a change in the community is very valuable. Too many young people fall victim to the substance abuse and addiction and, to substance abuse and addiction and the insidiousness of it. And policymakers have the ability to implement real change through the legislative process. So I'm going to use today and go to the Hill to be an agent of change.
Hello, everyone. I'm Lauren Foisey, and I'm from the Council Rock Coalition for Healthy Youth from the great state of PA. And I'm on a mission to create connections from youth to legislators. I'm here in order to bring to the attention of people who create policy that they have the potential to be champions by signing ATOD policies and by supporting drug-free communities funding and responding to the needs of their constituents. I will go on behalf of my peers and speak of risk factors with which my community struggles, and upon doing so, emphasize positive change created by new policy and action, or emphasize, as representatives of our state, what they could do and accomplish better.
Good morning. I'm Donna Foisey, and I'm from the state of Pennsylvania, from Buck's Promise for Youth and Communities and the Council Rock Coalition for Healthy Youth. We in Bucks County, Pennsylvania, have been agents of change by forming face-to-face connections at a local, state, and national level. We have been change agents by empowering our youth through attendance at NYLI to use their voice in their communities and on the Hill. 15 years ago, concerned local organizations formed a countywide consortium for prevention. We boldly invited our Congressman, Mike Fitzpatrick, to join us, and he did. We asked him to be part of our groundbreaking prescription drug back efforts, and he did. We introduced him to Sue Thaw and to CADCA, who asked them to reauthorize funding for the Drug-Free Communities program, and he did. Then he worked to ban Zohydro. He introduced a bill to reauthorize the STOP Act, and he became an outspoken champion for prevention on the Hill. All of this started by making face-to-face connections. Our mission today is very possible. Thank you.
Carlson, Becky Carlson, Vernon Coalition, Sussex County, New Jersey, and I am proud to be a change agent. You two are change agents on a mission possible to Capitol Hill. It's been 15 years since I came to my first CADCA forum, and I still love going up to the Hill. It's my favorite part of the week. The trip up to the Hill is so exciting. It's history past, present, and future, because we, the agents of change from all around the nation, can go up to Capitol Hill to make a difference. And we do. You heard it from our panel this morning. Our senators and our congressmen and our congresswomen know how to craft a bill, debate legislation, chair a committee, fundraise, get legislation passed for their and fundraise for their campaigns, all that to run the government. But we are the experts in the substance abuse prevention field. We have the stories happening in our communities, and you heard that from them today, that that's so important to let them know. So we need to go up there, share our stories, and we all have them. We need to share our concerns, share our successes, and share our outcomes. So I ask you, put on your marching shoes, go up to Capitol Hill to see all of your senators, your congressmen, your congresswomen as agents of change for Mission Possible. I want you to have a great day. Thank you.
All right, let's hear it for everybody who got up here today. Woo! Thank you. Okay, so I'm going to wrap up this rally with what I think are the 5 P's of effective advocacy: purpose, passion, perseverance, participation, and power. We need purpose. As John F. Kennedy said, efforts and courage are not enough without purpose and direction. Our field is mission-driven, and we have remained true to our shared vision of significantly reducing youth ATOD use and abuse rates at a population level. Do we have a purpose? You bet we do. We need passion. As Hegel said, nothing great in this world has ever been accomplished without passion. All of us passionately believe and are committed to doing ATOD prevention and intervention, treatment and recovery work. Do we have passion for our work? You know it. We need perseverance. This is a great quote from Newt Gingrich. Perseverance is the hard work you do after you get tired of the hard work you've already done. Have we all stuck in this field with the good times and the bad times? Have we dealt with whatever obstacles have come up and dealt with them together? Yeah. And have we kept going? Yeah. Are we still persevering? Yeah. You know it. Okay, we need participation. As Woody Allen said, 80% of success is just showing up. Right? I said it before, if you show up, it's impossible to ignore you. Over the past 25 years, we have showed up and participated in CADCA's Capitol Hill Day. You have educated your members about our issues and why they should support them. Today, everybody needs to participate and get on the buses and go to Capitol Hill. You need to educate about what we've accomplished, the fact that we are data-driven, cost-effective, and that we are facing some major issues: prescription drug abuse, heroin, marijuana, synthetic drugs, e-cigarettes. But do we know how to solve these problems? Yeah, we do. Do we have participation? You got it. Okay, So it's the synergy of the 4 Ps, purpose, passion, perseverance, and participation over time, with all of us doing our parts. That's what gives us the 5th P, power. Do you feel powerful? Are we the power of the movement? Are we going to use today to build on the power we already have? Okay, well, let's make the most of today. Today is our day to make a difference. Good luck, and most importantly, have fun with this. Have fun with this. Okay, so just a few housekeeping items. You're going to walk down the foyer, past the Maryland ballrooms, go out the doors. That's where the buses are going to be to take you to Capitol Hill. The cool signs that we have, you can't bring them to Capitol Hill. If you want to keep them, put them in a safe place somewhere so that they'll still be here when you return. And the reception, oh my gosh, the reception, we have Senator Portman, Senator Whitehouse, Senator Ayotte. Who else am I leaving out? Oh, we have Senator Grassley, who comes every single year from Iowa. We have Representative Crenshaw. He is the chairman of the Financial Services Appropriations Subcommittee. He's personally responsible for getting us the $93.5 million for DFC. They're all going to be at the reception. It's in Hart 902. Hart 902, and when you get there, ask the guards how to get to that room. God bless, good luck, and have fun.
Get up off of that thing and stand to do.